The severe winter weather creates even more complications, right, for the city's homeless populations in particular.
Yeah, a little over 90,000 people sleep in homeless shelters each night. But there are thousands more who sleep in public spaces and in subways. New York City Comptroller Brad Lander is joining us this morning to weigh in on this issue. So good morning to you.
Good morning.
Thanks for coming in on this snowy day. We really appreciate it. We're talking a very important issue, homelessness. It's on the rise. The migrant crisis certainly not helping. And then when you have days like this, that's when you realize how bad the issue is. What can be done to help the homeless crisis here in the city?
Yeah, so we took a look. We released an audit last week at this program called the Intensive Mobile Treatment Program that's designed for really the most at-risk folks. These are folks with a long history of homelessness, but also severe mental illness, in and out of jail or hospitals. And unfortunately, what we found is that that program, though it's a good idea, it's just not being managed effectively. There's no coordination between Department of Health and Mental Hygiene, who runs it, and Department of Correction, even though folks are in and out of jail. One guy, Rashid Brimage, was in and out of hospitals 5 times. His team didn't even know he was out there. He wound up assaulting a 92-year-old woman. 71% of the people in this program didn't take their medication regularly. So we made a whole set of recommendations for management reforms. And one of them is, let's get these folks off the street, target them with the vouchers that would enable them to be in some housing while they get the care they need so they could stay on medication, get treatment, and get in permanent placements rather than be a risk to themselves and to other people.
Is there, space with the voucher program? Is there space to take them off the streets and put them somewhere?
Yes. Well, this program is, kind of for the folks who are most at risk. Those 837 people in it, and it's folks you really don't want to have on the street. So yes, do we have 837 units? We do. We don't have enough for to solve the whole crisis right now. That's why we got to build more housing.
Who is tasked with going out and removing those folks from the street?
Yeah,
what if
so
they don't want to go?
There's 5 social service agencies that Department of Health and Mental Hygiene hires, but the audit shows we're just not holding them to clear standards. How often is somebody supposed to see a psychiatrist or see a nurse, take their medication, get those housing vouchers, and get off the street? This really is something we're spending $25,000 per person per year on. And we just need to get better services for.
Yeah, I mean, is there enough in the city's budget to handle the manpower to do this job?
This we're already spending. In this case, this is not a case of needing more money. Like we've got the service provision, we've got the money being provided. We have more than 800 available housing vouchers. This is a management failure, leaving the most vulnerable people on the street in a storm like this. And these are folks who, if they don't take their medication and get their treatment, may wind up in a psychotic state and be a risk to someone else, too.
When you say management failure, you mean the mayor?
The mayor, the Department of Health and Mental Hygiene, the Department of Correction are all, have work to do to
have they responded to the report?
Better. Department of Health and Mental Hygiene says they are going to set new targets to make the program run better, but not until 2025.
Okay.
All right, well, thank you for coming in.
Yeah, of course, thank you.
Stay safe out there today, okay?
You too,
Walking
get
around.
home safe, enjoy the day with the kids.
Yes.